Hello, Tiffany with Silver Lining Healthcare Institute, and we had a request for a video on how to take a manual blood pressure. So I'm going to show that to you today. Just remember that taking a manual blood pressure, because it is a learned skill, should be signed off by your physician just to make sure that you're doing it properly. So while anybody can do it, and you can get the basic tools to do it, you just want to make sure that you're doing it properly. So you need a stethoscope, and you can buy these online, single use even, but a little bit higher quality will give you more accuracy. It'll just make it easier for you to do. And then you have your manual blood pressure cuff. So parts of this, you have the cuff itself, you have your meter on the cuff, you've got your bulb, and you've got your valve, which is the turny thing right here. So to get ready, you're gonna go ahead and turn the valve all the way to the right clockwise and make sure it's tight. You're going to apply your cuff. Make sure that it's the appropriate size. If it's too big, you're gonna get a low reading. If it's too small, you're gonna get a high reading. You're gonna line it up. It always has typically arrows on, say, right arm. That's where you wanna line up. And you wanna line it up directly down through the middle of your arm. So you'll see these kind of veins here in the middle. That's what we're gonna be listening to, these vessels here. So you wanna line up the arrow right down the center of your arm. You're going to put your stethoscope in, so put the earbuds down towards your nose. And if you've never done this before, I would suggest you take a little listen to your heart. And you'll hear that beat. That's what you're gonna be listening for in your arm when you're taking your blood pressure. Depending on your body anatomy, you'll be able to hear your heart a little differently. So if you don't hear anything, move around till you can hear that boom, 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 boom. All right. Now you're gonna wanna sit this somewhere that you can see it very easily. So typically on a table right in front of you. Your meter. You're gonna place your stethoscope head right at this spot on your arm. So right below, it can even be tucked in a little bit underneath that blood pressure cuff. You're already tightened on your bulb. You're gonna watch your meter and you're gonna start blowing up that cuff. You should be feeling it inflate. Every pump you make, you should feel it inflate. You're gonna start by going up to 140 on your meter, and then you're slowly gonna let out the valve. Slowly. When you first hear that beat, that's your systolic blood pressure. And when you stop hearing a beat, that's your diastolic blood pressure. So that top number, say 120/80, you'll hear that 120 when it starts, and 80 would be if my blood pressure, if I stopped hearing that beat. Now let's say you didn't hear anything. A couple of reasons. A, you're not listening to the right spot, especially if it's your first time. It might take some practice. Or B, your blood pressure might actually be really high. So in that case, you're gonna blow it up again and make sure that you are sitting with your both feet on the floor. And you're gonna blow it up to say 160 or 180, and then slowly let it out. There we go. Perfect. So now I heard it. So you'll see again, that top number, when it starts, you start hearing the beat, and the bottom number is when you stop hearing the beat, and that's all shown on your meter. So I hope this helped you out a little bit today. Make sure you get signed off by your doc or someone that knows how to do manual blood pressures before you just start recording it. But I hope this helped you a little bit on your journey to taking accurate blood pressures.